Well, new here at 4 in just about 15 minutes. Denver Health will be joined by Denver Mayor Mike Johnson, Police Chief Ron Thomas, and others hosting a vigil to recognize the impact of gun violence on the community all around us. Dr. Claudia Kunrath is the medical director for Denver Health's Pediatric Intensive Care Unit, the ICU, and a member of the hospital's Firearm Safety Collaborative. She'll be speaking at that vigil and is here now to talk with us about it. Doctor, thanks so much for being here and talking about such an important topic. Kids and gun violence. I mean, how often are you seeing kids who are not just shot themselves, but are affected by gun violence one way or another over at the ICU and at the hospital?
It's quite a bit. If you think about our numbers, since 2017, we had 1,800 gun violence patients, 40% of them less than 25 years old. So it's a lot.
Wow,
yeah.
That is an awful lot. You treat an awful lot of them in the pediatric ICU. What do you want people to know about what you see when someone who is a young person is shot?
You know, the effects on the patient, their families, and their communities is incredible, right? It's the physical damage. They can stay in a hospital for months, and the psychological damage. And also for us healthcare providers, right? Like Denver Health, we take care of 40% of all the gun injuries in the state. Having to tell a mom that their kid is dying of senseless violence, like by guns, it's really mind-boggling.
Yeah, I imagine it weighs on you and the entire staff over there. When you talk about the effects of the gun violence, so obviously there's the physical impact and there are these physical issues, but what about what lingers on and on for years after that? What do you know about that?
Well, we know for a fact that there's severe anxiety, PTSD, right? A lot of these patients develop depression and also opioid use disorder.
Yeah, so there are a lot of ramifications. I know Denver, the mayor and the police chief have talked a lot about reducing sort of the incidence of gun violence in the city, but you still see it though, don't you, in terms of, let's just say, even if it's not a child who gets shot, if it's someone who's a little bit older, how does that affect them?
Again, depending where the injury is, right? Yeah. Like it can cause disability for the rest of their lives, plus the psychological one.
Yeah, right? And then you talked earlier about the family impact too. If it's someone connected to a child, there are ramifications there, even if the child is physically safe.
Correct, right? It's like all the anxiety. People don't want to go back to the environment that they live, right? And it's expensive to move. There's that guilt. There's so much going on.
Yeah, so I think the bottom line, what's the message that you, Denver Health, and the others who are at the vigil want to share this afternoon?
Well, we really want to come together with our community, work with our stakeholders to decrease gun injury. You know, we're doing a couple of things. We have like several awareness with gun shop owners to display their guns with also safety devices so they can take both home, right? And hopefully decreasing accidents and decreasing suicide. So little things, right? Be aware is a problem.
Yeah, the little things can hopefully add up and make a big difference in
exactly,
the community.
Right?
All right, Dr. Claudia Kunrath from Denver Health, thanks for coming in today and thanks for what you do. I appreciate it very much.
Thank you very much for having me here.